If you've been diagnosed with low thyroid, or you just deal with a lot of low thyroid symptoms, you might be wondering whether or not autoimmunity is playing a role in the way your symptoms present. Well, to help you out with that question, in today's video we are going to cover our thyroid pathway and how that can provide us context for how symptoms show up. We're also going to talk about the difference between autoimmune and non-autoimmune presentations of hypothyroidism. And finally, we'll talk about things that we need to look for as we get older, we age, and our body tends to change. That way we can be most proactive when it comes to improving and stabilizing our health. My name is Dr. Bodle, and I specialize in helping women with Hashimoto's and low thyroid lose weight and improve their energy naturally. And if this is the kind of information that is helpful and useful to you, and you haven't done so already, make sure you subscribe to the channel and ring the bell. I post videos every single Thursday, and if you do those two things, you'll be notified whenever I post new content. But let's begin today by just jumping into things and start by talking about our normal thyroid pathway. So our thyroid pathway always starts with our brain and it finishes with our cells. Every cell in the body has a job to do, and therefore, every cell in our body needs thyroid hormone. Thyroid hormone is what sets the metabolism for those cells. It's like the gas pedal. It gives them that get up and go. And if we have an inefficient amount of thyroid hormone that is either present in the body or being delivered to these cells, then that's when we can start to see symptoms show up. So if that cell is in our brain, we may have cognitive problems and brain fog. And if that cell is in our gut, we might see things like bloating, reflux, and indigestion. The location of where we see symptoms most is going to depend on the person and their particular health history and also the stressors that they have in their day-to-day life. Now, I always like to describe thyroid hormone by using the metaphor of running shoes. Running shoes aren't going to dictate what activity you choose to do, but they are there to help facilitate it. So whether or not you're someone who wants to go for a jog, you want to go out and walk your dog, or maybe you just need something comfy to be able to go to the grocery store or the mall. Depending on what you need, your running shoes are going to allow you to accomplish those tasks. But before you even think about going outside and going for a jog, you need to put in that order for your new pair of running shoes. And this is how that works and how it ties into our thyroid pathway. So once you put in the order, the company is going to receive that order and it's going to communicate that information to their production facility. The production facility is going to create a new pair of shoes. They're then going to box it up, send it in the mail, and once it arrives at your doorstep, you can then open up that box, put the shoes on, and engage in whatever activity you want to be able to engage in. And the reason why this is a great representation of our thyroid physiology is for two reasons. And the first is that you can see how if we have a breakdown in any part of the pathway from ordering to arrival at your doorstep, then we're not going to be able to put our shoes on our feet. So it doesn't matter if the order isn't received by headquarters or if we have trouble opening up the box at our front doorstep, breakdown anywhere causes us to not be able to use the shoes as they were intended. The second point is what we already touched on, which is the presence or the ability to put those shoes on your feet doesn't dictate what you're about to do. So for different people, not having those shoes is going to interrupt their life in a different way. So to tie this more specifically into our thyroid pathway, if there's ever a need or a demand for a product, whether that's running shoes or in this case, thyroid hormone, it all starts with our brain. Our brain is constantly sampling the blood and determining whether or not we have enough thyroid hormone or too little thyroid hormone. And if we are on the lower end of things, it will say, hey, I need to increase production. The way that it does that is it sends out an order form in the form of TSH. TSH is a brain-released hormone and it stands for thyroid stimulating hormone. When it's released into the blood, it moves to our thyroid gland and it stimulates the thyroid, exactly what it sounds like. So I always think of this as that order form. It's saying, hey, we need more thyroid hormone and this is the amount that we need. Once that hormone reaches the thyroid gland will then increase production of T4 primarily and a little bit of T3. T4 is the inactive version of thyroid hormone, and the reason that it's created in that way is because, as we said before, every cell in the body needs thyroid hormone, and so you have to ship it to all parts of the body. The best way to do that is to box it up or put it in its inactive form. Once it creates the T4 is circulated through the bloodstream. When it arrives at the cell that is needed, it then converts that T4 into the active version, which is T3. So T3, you can think of it like you've opened up the box, you've pulled out those running shoes, and now you can actually put them on. T3 is equivalent to the active version of those running shoes. So once you have your running shoes available, once you have the T3 available, then you can actually set your metabolism and set out to do the job that you want to be able to do. But the reason why I wanted to kind of hammer this analogy is to really help you understand that your thyroid symptoms are not specific to the area of breakdown. So if you don't have your running shoes on your feet and you can't go out and do whatever activity you want to participate in, that doesn't tell us anything about where the breakdown was in the supply chain and why you don't have those running shoes on your feet to start with. So unfortunately, whether it's fatigue, weight gain, hair loss, digestive symptoms, weak nails, dry skin, brain fog, whatever you're dealing with, none of those things tell us whether or not you have an autoimmune issue or a non-autoimmune issue that is causing those low thyroid outcomes. So if the type of symptom doesn't tell us whether or not we have an autoimmune thyroid condition, and our goal here is to discern what kind of symptoms do indicate that, what are the differences and what can we look towards to be able to help us better understand what's going on with our physiology? And the answer is it's the timing, frequency, and progression of symptoms that makes autoimmune thyroid conditions different than non-autoimmune situations. When we develop antibodies for our thyroid gland, which is the hallmark of autoimmunity and also the part of the immune system that is used to fight off bacteria, viruses, and parasites, those antibodies are not always consistent in the bloodstream. That means that if we have increased stressors in our life, there's an increased likelihood that there's going to be more immune system activity. And when those calm down, there's going to be less immune system activity. So, due to the fact that those can fluctuate, we can also see fluctuations in the way our thyroid works, and therefore that will reflect in the way we feel and the way our symptoms present. To put it another way, autoimmune thyroid conditions, at least in the beginning, are rarely consistent and stable. Instead, they tend to fluctuate depending on the amount of stress and immune system activity which is present in our body. This means that there will be times where you feel better and there will be times where you will feel worse, and there isn't always a lot of indicators for why that is happening. Over time, and as the autoimmune condition continues to progress, there will be less frequent fluctuations in your symptoms, and things will trend towards a more consistent hypothyroid state. An easy way to know whether or not you've progressed past those initial stages, which for some people may be months, and other people it can be years, is that if you have certain symptoms like weight gain, for example, and in the past you were able to kind of buckle down, focus on your diet, exercise a little bit more, and that would help you to lose weight. But now it seems like no matter what you do, nothing will cause your weight to budge. Additionally, maybe you've always had a little bit of issues with energy, but in the past you were able to push through and make it to the end of your day. Nowadays, maybe you get home and you want to just veg out, do nothing, and you're looking to get to sleep as soon as possible. So just remember, in autoimmune thyroid conditions, our symptoms will tend to fluctuate early on before becoming more consistent. It's the nature of the progression of the symptoms which is specific to autoimmunity rather than the symptoms themselves. But I'm looking forward to having a conversation with you guys about this, and I'm curious, is this something that you are aware of? Either way, let me know in the comments below, and maybe we can start to figure out some different things that you can start doing to better understand what's going on with your thyroid health. Now, last thing that we want to cover is prognosis and progression. Now, there is hope with these types of autoimmune conditions, and even though our immune system maintains that memory for our entire life, leading to the increased likelihood of flare-ups, we can support our immune system in a way where we minimize those attacks and it allows us to heal and function optimally. However, if we're not managing things well and we continue to expose ourselves to triggers, whether it's bad dietary choices, poor sleep, chronic stress, decreased movement, whatever it might be, then there's an increased likelihood that the autoimmunity that is associated with our thyroid gland can then spread to other tissues and organ systems within the body. The reason for this is because the parameters that allowed you to develop the autoimmune thyroid condition in the first place, which includes genetic predispositions, breakdown in barrier function, and a triggering event, are also still in place for the development of other autoimmune conditions, again, if not well managed. Autoimmunity tends to beget autoimmunity, and that's why you see such strong correlation between things like people with Hashimoto's also have autoimmune gastritis or celiac disease. Now, I do want to be clear and say that just because you have an autoimmune condition doesn't mean that you have a second one, nor does it mean that you're going to develop a second one. But if that inflammatory environment persists, there is an increased likelihood that those secondary conditions will occur. But I'm not saying this to scare you or to stress you out. I'm saying this to provide context as you move forward on your health journey. So if you start to develop unrelenting symptoms in other parts of your body that don't seem to be thyroid related, maybe you have nutritional deficiencies that won't resolve, or you're starting to have widespread joint pain. Because you've already identified the fact that there's an increased likelihood of you having an autoimmune thyroid condition, you then want to think that when these other symptoms start to pop up, there's the possibility that autoimmunity could be involved in those areas as well. So if we're dealing with low thyroid symptoms like fatigue, weight gain, hair loss, and digestive issues, none of those symptoms are specific to any one area of breakdown in our thyroid pathway and doesn't help us to understand whether or not we're dealing with autoimmunity. What can indicate that autoimmunity is present is the progression of symptoms. So early on, we're going to see fluctuations where we will have times where we will feel better or worse. And over time, that frequency of fluctuation will decrease and it will eventually progress towards more consistent hypothyroid symptoms. Lastly, if we do think autoimmunity is present in our thyroid dysfunction, then we need to be aware that that can spread to other parts of our body. So if we start to have generalized, unrelenting symptoms that seem to be unrelated to our thyroid gland, then we need to make sure to do our due diligence and at least check in and see if autoimmunity is present in those parts of our body. But if you're ready to take the next step and you're looking to work with someone who really understands how our thyroid gland can affect all areas of our physiology, then send me an email at contact@seattlethyroidhelp.com and I will get you the information that you need to be able to set up a free consultation with me so we can take some time, figure out what's going on with your health, and determine if we're a good fit to work together one-on-one. If not, and you'd like to start doing some things at home on your own time, make sure to check out my free guide at the link in the description box below, which is 109 foods to boost your thyroid and improve your energy. And it includes a list of foods that you should and shouldn't be eating when you start out on your thyroid journey and are looking to make some quick changes. But that's all I have for you guys today. Thank you so much for hanging out with me. I love having you guys here. And if you like the video, I always appreciate it if you can give it a thumbs up and subscribe to the channel. Also, if there's anything else you need, you're always welcome to reach out to me. I'm happy to help you out in whatever way I can. But with that said, my name is Dr. Brad Bodle. I hope you guys have an absolutely outstanding and wonderful day, and I will see you guys next week.